Out of the clear blue, I received a phone call from one of the producers of Grey's Anatomy, Linda Klein, and she introduced herself by telephone. She was on the phone with her assistant, and I almost didn't believe that she was, really from Grey's Anatomy. And so I started talking to her about her interest in a patient we had treated years ago, and I was surprised she knew Ian's name, because she said she had read about our approach to the procedure from 9 years ago, and she used his name. And I asked, well, how did you find out about this? How did you find out Ian's name? And she had read about it in a women's journal. Oh, I was thrilled with the way Grey's Anatomy handled the story. They really did an excellent job. They took a very, very complex birth defect of the heart and a very complex situation and presented it beautifully and dramatically. They simplified things quite a bit, but I think, for the sake of a lay audience, they had to do that. But they did a great job. Well, Mrs. McDonough was having a very routine pregnancy. Her obstetrician noticed on a routine obstetrical ultrasound that the baby's heart didn't quite look normal. So he referred Mrs. McDonough to my partner, Dr. Bettina Cuneo, who made a very astute observation. First, she diagnosed the hypoplastic left heart syndrome, which is a rare heart condition, but we see that 25 to 30 times a year. But what Dr. Cuneo did a phenomenal job at was diagnosing an extremely rare associated problem in which there was what we call an intact atrial septum. So we knew, Dr. Cuneo knew right away, that as soon as Ian would be born, he would start dying, because there was no way for the red blood and the blue blood to mix in the heart without a hole in the heart. And so what we knew is that as soon as he was going to be born, he would have problems. And that's why we said, let's have him be born in the cardiac cath lab where we can immediately start doing the procedure. And that's what we planned to do. And they depicted that beautifully on Grey's Anatomy. He was born in one cardiac cath lab and then carried over just 10 feet away to the next cardiac cath lab where we were all waiting to do the procedure. So Ian did beautifully with that procedure. He went through 3 open heart surgeries in the first 18 to 24 months of life, 5 cardiac catheterization procedures, and now he's 9 years old, and you can't tell him apart from any other 9-year-old, as long as he's got a t-shirt on, because you can see the surgery scars. But he runs and plays, and he loves playing golf. He participates in gym class. He's a phenomenal, rambunctious little boy, typical little boy.
We came here to Advocate Children's Hospital because of the doctor in Rockford sent us here. He said, you can have the baby here in Rockford. We're not equipped, but Advocate Christ Hospital is. So they sent us here. We were shocked because we have 2 healthy girls, and so we were very surprised. But the whole time I didn't have a doubt in my mind that he wouldn't make it. I'm very excited to have this story be part of Grey's Anatomy because it brings awareness to what Dr. Javoy and the hospital has done to help my family.